Good morning. I'm Dr. Sunaina Tejpal Karna. I'm an associate professor in the Department of Anesthesiology and Critical Care at All India Institute of Medical Sciences, Bhopal. During the COVID-19 pandemic, we received a lot of patients from Central India with severe COVID-19 infection. And our center was the main referral center and was a dedicated COVID unit during the second wave of the pandemic. We saw that many patients had respiratory symptoms, but a few also had digestive symptoms, the exact frequency and significance of which was not known in the Indian scenario. With this research gap, we conducted a prospective observational cohort study to find the frequency and impact of these pre-admission digestive symptoms on the overall course of the patient and the overall outcome. Once the patient was admitted to our institute and needed intensive care because of severe COVID-19, we specifically sought history of either of the digestive symptoms of loss of appetite, nausea, vomiting, diarrhea, abdominal pain, abdominal distension, gastrointestinal bleeding, which was often missed or ignored in presence of prominent respiratory symptoms. We also looked at the demographic clinical characteristics, the vital signs, the laboratory parameters of the patient at the time of admission. Then we followed the patient throughout the course of critical illness to see the need for invasive interventions and the organ failures which happened during the course of illness. And then we saw the outcome in terms of mortality and the duration of ICU stay. What we found was that out of the 1,338 patients who were admitted to our institute with symptomatic COVID-19, 234 patients needed ICU admission with severe COVID-19. Out of these patients, 76 had associated digestive symptoms, and amongst these, 1.4, that is 4 patients, 1.4% patients had exclusive digestive symptoms. On finding the association of various demographic and clinical factors with digestive symptoms, we found that they were more prominent in males, in those who had a lower fibrinogen or a lower BMI at the time of admission. On comparing the groups with and without digestive symptoms, we found that though the inflammatory markers were lower at the time of admission in patients with pre-admission digestive symptoms, the overall course of illness was very turbulent, with higher need of non-invasive mechanical ventilation, higher need for invasive lines, vasopressors, transfusion, surgery, and a higher incidence of heart failure, and ultimately a higher proportional mortality rate in patients with pre-admission digestive symptoms. Though we did not study the mechanistic causes for injury in patients with or without digestive symptoms, but we do think that there was a vital bidirectional crosstalk between the gut and the lung. And on evaluating the predictors of mortality in those patients who had digestive symptoms, we found that the odds of mortality were higher if there was presence of pre-admission abdominal pathology, pre-existing hepatobiliary disease, pre-existing CNS comorbidities. These were the patients who had a poor nutritional status, they had a poor oral intake, and a weakened immune system already. Further, if more than 5 digestive symptoms were present, then that also led to a higher odds of dying, laying emphasis on multiple levels of involvement of the gut. Similarly, if the patient had acute kidney injury grade 3 during the course of intensive care, then that also increased the odds of dying. If the SOFA score at admission was more than 5.5 and still remained more than 4.5 at the time of discharge, that also raised the odds of dying. So these were the factors which we found which were associated with mortality in patients with pre-admission digestive symptoms. Amongst these, AKI grade 3 was a modifiable factor. I do believe that this study is very important and will add to the existing literature in terms of the frequency and significance of these pre-admission digestive symptoms in the Indian scenario. Because once we know the modifiable factors, we'll be able to act on it and prevent mortality in such patients. Thank you.